Monkeypox, a rare viral disease similar to smallpox but generally less severe, has gained attention due to recent outbreaks. While it primarily affects adults, children can also contract the virus. Understanding the symptoms, risks, and safety tips related to monkeypox in children is essential for keeping them safe and healthy. Symptoms of monkeypox in children. Monkeypox symptoms in children are similar to those in adults but can be more severe, particularly in young children or those with underlying health conditions. The symptoms typically appear within 5 to 21 days after exposure to the virus and can be divided into 2 stages. Number 1. Initial stage, prodromal phase. Fever. One of the first symptoms is a high fever, which can last for 1 to 3 days. Headache. Severe headaches may accompany the fever. Muscle aches and backache. Children may complain of muscle and back pain. Swollen lymph nodes. Lymphadenopathy, or swelling of the lymph nodes, is a distinguishing feature of monkeypox and can be found in the neck, armpits, or groin. Fatigue. Children might feel unusually tired or weak. Number 2. Rash stage. The rash typically appears 1 to 4 days after the onset of fever. Development of rash. The rash often starts on the face and then spreads to other parts of the body, including the palms, soles, and even inside the mouth. Progression. The rash goes through different stages, starting as macules, flat lesions, then progressing to papules, raised lesions, vesicles, fluid-filled blisters, pustules, pus-filled lesions, and finally crusting over and falling off. Itching and pain. The lesions can be itchy or painful, and children may be more prone to scratching, which can lead to secondary infections. Risks associated with monkeypox in children. While monkeypox is generally not as severe as smallpox, it can pose serious risks, especially in children who may have a weaker immune system. The following are key risks associated with monkeypox in children. Severe illness. Children, particularly those under 8 years old or with compromised immune systems, are at a higher risk of severe illness. Secondary infections. Scratching the lesions can lead to secondary bacterial infections, which can complicate the disease. Dehydration. Fever and rash can cause discomfort and reluctance to eat or drink, leading to dehydration. Complications. Rare complications include pneumonia, sepsis, encephalitis, inflammation of the brain, and eye infections, which can result in vision loss if the lesions affect the cornea. Safety tips to protect children from monkeypox. Preventing the spread of monkeypox in children involves careful hygiene practices, awareness of symptoms, and prompt medical attention if exposure is suspected. Here are some safety tips. Number 1. Practice good hygiene. Hand washing. Encourage frequent hand washing with soap and water, especially after contact with a sick person or animal. Avoid touching lesions. Teach children not to touch skin lesions or rashes on themselves or others. Disinfect surfaces. Regularly clean and disinfect surfaces and objects that are frequently touched. Number 2. Avoid contact with infected individuals. Isolate the sick. If someone in the household is suspected or confirmed to have monkeypox, they should be isolated from others, particularly from children. Avoid sharing personal items. Do not share towels, bedding, clothing, or utensils with someone who has monkeypox. Limit exposure to animals. Avoid contact with wild animals, especially rodents and primates, which can carry the virus. Also, avoid contact with pets that may have had contact with infected animals or individuals. Number 3. Monitor for symptoms. Early detection. Be vigilant for any early signs of monkeypox, especially if there has been potential exposure. Early detection can help manage symptoms and reduce the spread of the virus. Seek medical attention. If your child shows symptoms of monkeypox, especially fever followed by a rash, seek medical attention immediately. Number 4. Vaccination awareness. Vaccination. Currently, the smallpox vaccine offers some protection against monkeypox. Consult with your healthcare provider about the availability and advisability of vaccination, particularly in areas with reported cases. Number 5. Educate your child. Teach awareness. Educate your child in an age-appropriate way about the importance of hygiene and avoiding contact with people who are sick. Stay calm. While it's important to be cautious, avoid causing undue anxiety in children. Reassure them that taking simple steps can help keep them safe. Conclusion: while monkeypox can be concerning, especially for children, understanding the symptoms, risks, and preventive measures can help you manage the situation effectively. By practicing good hygiene, avoiding exposure, monitoring for symptoms, and seeking prompt medical care, you can protect your child from this illness. Staying informed and following public health guidelines are key to keeping your family safe.